The takeaway message of our article is that social isolation is more common among United States physicians than workers in other fields. And social isolation is associated with increased burnout, reduced professional fulfillment, and suicidal ideation. I'm Colin West, professor of medicine, medical education, and biostatistics, and medical director of employee well-being at Mayo Clinic. Our paper entitled Social Isolation and Burnout, Professional Fulfillment, and Suicidal Ideation among United States Physicians will appear in Mayo Clinic Proceedings. In this study of more than 3,000 United States physicians, we found 28% higher odds of feeling isolated among physician respondents than workers in other fields. Among those with the worst social isolation, nearly 2/3 reported burnout, whereas this was only 15% in those with the least social isolation. We saw similar dynamics in association with professional fulfillment and suicidal ideation, with harmful associations with social isolation. In addition, increased social isolation was seen among women physicians, those earlier in their career, and unmarried physicians. These results highlight the relevance of community building efforts for healthcare professionals. One mechanism to support this that has been implemented at Mayo Clinic are compass groups, which stand for Colleagues Meeting to Promote and Sustain Satisfaction. These are repeated meetings of small groups of physicians that have been studied in 2 randomized trials at this point. The discussion groups orient around topics related to the physician experience, and these groups have been demonstrated to increase meaning in work and reduce burnout among physicians. They work by building community, shared experiences, reducing the sense of feeling alone in the work that physicians do, which ties in with our findings in the current study about the risks of social isolation among physicians. What does this mean for patients? Healthcare professionals need to be well to deliver the best possible care. Part of this involves sustaining support networks for well-being, so the adverse consequences of social isolation can be mitigated and potential downstream consequences for patients can be avoided before they even begin. The next steps for this line of research involve continuing to explore experiences associated with both distress and well-being among physicians, and developing and testing interventions to promote social connection to help physicians thrive and flourish in their challenging yet deeply meaningful careers. Thank you for your interest in this research.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.